8:30. Although a Labrador faces a risky operation at the Pet Surgeons.
Here in Cork, there's a state-of-the-art animal practice with a very special team of vets.
These are directly close to the spinal cord, and if we push too far, it's danger.
Every day, clients come from all over Ireland.
No, kissing. It's a first date.
For the most advanced veterinary and nursing care.
Basically, this is a bite wound, which you would manage the same, be it dog or cat.
This is the story of Gillaby Veterinary Hospital. Its staff and its patients. From beloved family pets to exotic wildlife. From cats and dogs to parrots and cheetahs. You never know who or what will come through the door next. Every day is different in Gillaby, but one thing that never changes is the noise.
I think we should definitely have the earplugs that people wear in nightclubs, because it's probably easier to work in a nightclub with the music on behind you rather than 7 or 8 really loud barking dogs.
Yeah. Oh wow! Don't like kennels. Don't like all the barking. I like them being nice and calm.
As soon as you come in, they're kind of quiet, but as soon as they know there's somebody here, it's just like straight away, oh, get us out. You know, isn't this like
It's
chaos?
constant.
With not one, but 2 families utterly devoted to him. Frankie is normally one of the happiest labs in Waterford, but not today. Lately he's been having trouble breathing, and his owner's neighbour Cullum has brought him in to see vet Sheila.
This dog's name is Frankie. He's 11 years of age, an absolutely beautiful dog, really is. Every morning at 8:20, he arrives at the house demanding that we take him for a walk.
Walking Frankie on the beach one day, Cullum discovered that the old boy has an expensive taste in refreshments.
A really warm summer's day, and I had no water with me, and he got very thirsty. I could see it along the way, and I had a bottle of Pellegrino sparkling water with me. He took to it, and he drank the rest of the bottle, of course, leaving me parched with the thirst. And he really has very expensive taste, this dog, probably the costliest dog in the whole of County Waterford. He just loves Pellegrino.
I know he's hypothyroid. I can certainly see he has some changes on his face, probably associated with that.
Vet Sheila is Gillaby's resident internal medicine specialist. Her expertise includes liver, kidney, and respiratory diseases.
So we initially assessed the animal in that first minute or two, and then we spent a lot of time speaking with the owner, going through the history, trying to tease out what the owner's problems are and what they've noticed.
So what you're worried about is such as an abnormal airway noise.
Yeah, that's the biggest thing.
And it's really a problem-based approach, and it's a problem-solving. It's a bit like a detective story.
Has he ever passed out or become weak?
No, nothing that, well, he's never passed out, but occasionally he'll stop. You know, he'll just kind of stop and sit down, and then maybe a minute, 2 minutes later, he'll get back up and he's off again.
So for about the last 6 months, the owner says that when he gets excited or at the beginning of exercise, he makes a rasping noise. It sounds, from what the owner's describing, that it's upper respiratory tract.
Both Shane and Sheila suspect that the cause of Frankie's breathing difficulty may be a disorder of the larynx or voice box.
So in the normal healthy dog, this voice box should be nice and patent, nice and wide. And what's happening with Frankie is that he's had damage to the nerve that supplies the voice box. And what happens when that nerve is damaged is initially one side collapses, and when the other nerve is on the other side is affected, both sides collapse. So now he's trying to breathe through this tiny airway.
So when Shane examined Frankie's larynx, he could see that he had laryngeal paralysis. The larynx has 2 gates protecting it. They're called the arytenoids. When an animal breathes in, they open, and when they breathe out, they close a bit. And what was happening in Frankie's case was that they weren't moving properly. They were paralysed. So every time he was taking a breath, instead of them opening and closing, they were just static. So what Shane has to do is pull one of those back to keep it open. Now, in doing that, you run the risk that now food can enter the airway. So one of the biggest risks is aspiration pneumonia after surgery.
Not all of Gillaby's patients are brought in by their owners. Last night at home, intern vet Sophia noticed a pigeon in difficulty on her window ledge.
It was torrential rain, and he was absolutely miserable looking. You know, he was all huddled up on the little windowsill and just awful looking. So I noticed him there, and he was there about 2 hours, and he was moving closer and closer to the corner, not going anywhere. So I decided then to take him into the house. I realised when I went outside and picked him up that he had a little ring on his leg, so I knew he was a homing pigeon. And I presume he was either exhausted or lost.
You just pull it out to see if there's any evidence of bleeding or injuries underneath.
But it's great that we do have the Lexpat here, you know, and he was able to help out and tell me exactly what was up and have a good look at him.
This little fella, Sophie, just on first inspection, anyway, he feels underweight. Okay, your average pigeon will be around 400 or 500 grams. We always have a look at inside the mouth to see if there's any evidence of infection, and there it isn't as far as we can see. Give it a examine. their claws, and they're quite clean. There's no evidence of any disease. There's no evidence of any fractures. You can see there's good movement and mobility there.
So would you suggest then to administer antibiotics?
Absolutely, and then some maybe supportive care, maybe some critical care family just to build him up a little bit. Fortunately, I had the good sense to land in your window, so there was a little bit of luck.
While Pat finishes his examination, Nurse Gus is trying to locate the pigeon's owner.
The Irish Homing Union have a webpage for such instances finding racing pigeons. You put in the ring number of the pigeon and your phone number. They automatically send out an SMS through the Irish Homing Union, and they've located the pigeon breeder, who is Peter Whelan, and he's received a message from me, so we're just waiting for him to contact us, and we'll return the pigeon to him.
And time to hit me.
While they wait for the owner to make contact, Sophia and a rather tentative Nurse Maeve give the pigeon a little medication for its infection.
Do you want to hold?
It's not that I don't like birds, but I don't like the way they can kind of go at your face. If you're like, let's say if I let it go, they might go at your face. But
Yeah, I have a fear of birds too.
yeah, it's just because they
Their wings, yeah.
Yeah.
Or do you want to try and medicate?
Hold her.
Okay, so just keep her wings down. And she was terrified. Just, the wings flapping and, oh yeah, I think she gave a bit of a scream. Don't pick at me, bird. Oh, bird pet. Okay, that'll be enough. Just forward pet, yeah.
I've just been on the phone to the owner of the pigeon. He's from Dungarvan. Not sure what the story was in with the pigeon going back to Dungarvan, or was it going somewhere else? So one of our nurses here is from Dungarvan, so with a bit of luck, she'll be able to take it down and beat him, and a happy ending. Very important pigeon, is it?
Fully sedated, the time has come for Frankie the lab to be brought in for surgery.
And so for somebody like Frankie, there's a surgery where we make a small incision, but it's a tricky little surgery where we're trying to find the right little piece of cartilage. And what we want to do is we want to pull that cartilage and open his voice box.
People like me who do internal medicine and the surgeons have a very different mindset, I think. I quite like the investigation of it and working it up and the thought process that goes into it. And while I'm not a surgeon, I think the surgeons like to get in, fix it and move on, and it's I'd imagine it's much more black and white for them.
So this is what we call a soft tissue surgery. So very different to our orthopedic procedures. A lot more careful dissection. It's not the simple, straightforward, go straight in and feel where the fracture is. You've got to know your anatomy, and particularly working in the neck area, we're surrounded by nerves and blood vessels and critical organs. So it's just that this kind of surgery is very challenging. So for us with the surgery, we come in from the side and we pull this cartilage open, and we're going to find his voice box, lift this little piece out of the way, and inside is going to be a second cartilage that I'm after. And what I want to do is I want to put a needle into this little cartilage and open up his airway, and then use that suture to fix it in that new position. So I'm helping him to breathe. But we've now created an abnormal permanent opening for him, and the potential consequences are he can take some food or liquids and it can go into his lung. So this is the thyroid. So now we just lift that up. You're going to lift it for me, and I'm going to clean that so I can see a little bit better on the inside.
After an hour and a half of surgery, Vet Shane finishes up. The nurses will now take over as Frankie recovers. Next morning, Frankie's already back on his feet.
Come on, big fella. We'll take a treatment, and they might just take his catheter out. Good boy. Good boy. You know about this fella, don't you? He lives with one family, and when they go off to work, he moves to another neighbouring family and spends the day with them. They love him to bits. The second family have a dog during the day, which they give back at night, and they don't have for weekends or nights. And so all day long, he's got people that adore him.
The first time I heard that, he was like, there's this dog who was drinking Pellegrino, which is expensive, and I didn't even try it in my life because it was too expensive to buy. So I had to meet that dog. And then when you did meet him, you're like, yeah, I can see why you get Pellegrino.
We get some animals coming in here, and they'll just want to get out of that cage. They're not used to it. And so in some cases we will take the cases in, take the animals in, we'll operate on them, we'll get them home the same day. And if they're stressing and panicking, we'll certainly get them home as quickly as we can. Even critically ill cases, and once we got them over the critical part of their disease, once they're on the way to recover, some cases we'll send them home earlier than we would normally do, just because it's better for them.
Having decided that Frankie will recover best at home, Shane calls his owners to let them know. Over the weekend, Labrador Frankie's condition deteriorated and he was rushed back to Killaby. Shane was right to be concerned about the newly opened airway. With Frankie in serious difficulty, Vet Gemma was on hand to care for him.
Hi, Frankie. Hello.
So I got a phone call on Sunday morning from Frankie's owner. He was very concerned about him and said he was really weak and not moving, and I knew that wasn't right, so I asked him to bring him straight down.
When I got him in, about an hour and a half later, I suppose, even less, they said that had we taken another couple of hours, he was going to be dead.
He was in septic shock because he had aspirated or inhaled some saliva or food into his lungs, and it had set up a severe pneumonia, which caused him to have a generalised infection in his body. Emergency treatment was given. He was started on intravenous bolus fluids for his shock.
He was in a dreadful state. He couldn't move. He was really in a coma. I tried to lift him up and put him standing on his feet. He couldn't stand at all.
He was started on various antibiotics. He had his blood sugar levels supplemented. He was started on oxygen therapy.
So we were really lucky that she was on duty when Frankie had a crisis. And being the vet on duty for the weekend with a skeleton nursing team, she saved his life.
Frankie's owners, the Currans, have arrived from Waterford, desperately worried about their beloved pet.
There's always a risk with the fact that his larynx or the throat is tied back. I think he's unlucky. Again, it's a lower percentage that develop it, less than a kind of a quarter. He was just after a surgery as well, so his defences will be down a little bit. When we have to pass on, bad news to an owner, it is a really difficult time. It's, the close bond they have with their dog.
You can see, he's making a big effort, it's taking a lot out of him,
Plus the breathing, he finds it hard to have a bit of breathing.
Everything is an effort at the moment.
It's probably one of the most challenging aspects of the job. It is quite draining because you do take it on board.
He's just
a gorgeous
dog, and as he grew up with our own family, and now the grandchildren, they just love him, and they can sit down with him and jump on his back, and he'd never react.
We first got him at 6 weeks old, and he was adorable, as you can imagine. He just looked like the ad for the toilet rolls, and he's been family pet ever since, so we've had him now 11 years.
Well, he was always a fighter, so I'm sure he'll fight this one too. All right, Frankie? Huh?
Owners are different, and he is quite optimistic all the time and sees the positives, which is good in a way, but you have to be realistic about it and take the bigger picture into account as well. Regardless, he will have a longer stay here and need quite a lot of nursing care over the next week or so. If we're not seeing an improvement in the next few days, we will need to speak to Frankie's owners about, potentially making an alternate decision for Frankie, because we don't want him suffering either.
Having developed a bond with a poorly pigeon she found at home a few days ago, Vet Sophia has volunteered to reunite him with his owner in Dungarvan.
Yeah, he went missing last Sunday from Skibbereen, which is 82 miles to here. It was only his second race. He never raced as a young bird. He had maybe 20, 30 training tosses as a young bird, but never raced as a young bird. He was kept for breeding because he's very well bred. Done very well in his first race, but second race went all wrong.
So he had a little bit of discharge.
But look at the way
Ways in Australia, you can see that, yeah?
He obviously hit wires. Electric fence wires and paddocks.
Okay.
Yeah, first of the season, lifts. First come behind on seat, let's do that.
Okay.
And with the northeast wind last Sunday when they were racing at Skibbereen.
So that's where he was racing,
was
it?
They were down on the ground coming. They were very low, keeping down there with the wind. That's what happens. He's flown out, as you can see. His muscles.
Yeah, he's
completely flown out. He broke his heart to try and find home. He'll be left to recuperate, see what he's strengthened up. If he strengthens up, flies well with the rest of the flock, he'll go back racing. If not, he'll race next year. He'll get another go next year. This is his box. He's raced Saturday as well, or Sunday as well with him.
In the same race? But these guys all came back?
Yeah, all these guys came back.
And are you missing any other one? Or
there's two more missing.
Okay.
There's two more missing, yeah. Now, whether they just went on and couldn't make it back with every morning it was raining. So
that would interfere, wouldn't it?
Yeah, thunder in the air is deadly.
Yeah.
They just can't navigate with thunder at all. We had a pigeon here a few years back. That was his box there. They'd always known he was going to win. When his hen would win of a Friday evening, he'd fly out to here and back in, fly out and back in. He'd keep it up where the hen would be in the box. You could put your shirt on. So guaranteed he'd win.
Back at Gillaby, the nurses have been monitoring Frankie's condition very closely. For the last 48 hours, he's been on intranasal oxygen and a nebulizer to help his breathing.
I spent so many of my days with Frankie. I used to give his nebulizer for 20 minutes, so that when he was used to put his head in my lap, and that was rest time, that was downtime for Frankie, and downtime for me. So he loved being rubbed. To be honest, I was there a lot, so he kind of had no other choice but to love me.
You don't tell me he drinks it from the bottle.
Drinks it from the bottle.
What is he like? When they get this aspiration pneumonia, a lot of them don't make it through the recovery period, and you've seen with him just how sick he's been over the last number of days and how it's taken a full week to help him to recover. But he's making progress. Every day he's getting a little bit better, and as long as he's not suffering, we keep going with that.
In nearby Glanmire, the Williamson family have had their hands full for the last 8 weeks. Today, owners Joanne, Ted and their kids will bring a litter of 10 lively pups to Gillaby for microchipping and vaccination.
These beautiful 10 pups are just very quiet right now, and they won't be for very long because they've been a right handful, but they're going off to their new homes now at the end of the week.
Well, they love running around in the garden and getting all lucky, and they ripped up a plastic bag this morning. No, they're weak.
I suppose it's an old wives' tale, that if you let a bitch have a litter, that gives them a bit of longevity life-wise, I suppose. As I said to you, I don't know whether it's true or not, but we've heard that. Generally what she'll do is she'll hop up on top of a couch, and she's found a little way to kind of interact with them where she sits on the couch and she'll put her 2 paws down so they can't get at it, but she can kind of interact with them.
This is Arlo, he's my favourite. He was the 4th pup that was born, and he was much smaller than everyone else. Hey!
Give it. Give it.
Hopefully they're better travellers than their daddy.
And their mummy. Oop.
Fresh, like.
Oh god, that really smells.
Do you want one? Do you want one? Open your window.
How are we going to get them in to the surgery? No, not you.
He's eating a curry! He's eating his pubes!
There's 5 pubes.
I'd say it's tough in the delivery trade because the workers never seem very happy. They've got so many rules and things to be ticked and times to be written and stuff like that. It must be like, I just want to deliver stuff. Well, puppies are always a favourite. We love them, and it's fabulous when puppies come in and it's quiet and you can actually enjoy the puppies. I hate when it's crazy.
Since March of 2016, all pups born in Ireland must be microchipped before they're 12 weeks old.
And the puppies come in, you're like, just want to grab them. And you can't. It's so unfair.
So they're husky with...
Your dad is a husky retriever and the mum's a lab.
So husky retriever and a lab, yeah. It's a good day when you see a puppy. Or a kitten.
Yeah, everybody thinks we hang around all day cuddling puppies and kittens, but unfortunately that's not every day. But it is nice though.
Yeah.
She's one of the biggest ones, Gloria. She's she likes to be on her own. But when she feels like she'll go around and starts kind of pushing the others around, but he gets stuck into her.
Was the birth all uneventful, or
It was eventful. Kerry helped to deliver a few. I think the first or second one of them got stuck, didn't they?
will you miss them?
Yes.
It will.
I have tissues on my sleeve.
Ready for it.
Vet Gemma will now weigh, vaccinate and microchip all 10 pups. First up, the smallest of the litter.
Good boy, Arlo. Didn't notice.
He's a tough guy, isn't
He didn't yelp at all. For the microchipping and the vaccine.
Oh, good boy. I think I once had a Rottweiler that had 13 or 14. Anything over 10 is pretty big.
Okay, last one, Cara. Who is it? He's done a runner. Now, last one. No, not a peep out of you.
Hopefully, none of these pups will be back in Gillaby anytime soon. It's been 6 weeks since Frankie's surgery. At home with his 2 beloved families, he's on the mend and back to his daily routine.
If he didn't go for it, he wouldn't have lasted 12 months, And he was frail and everything. But over time then...
Like anyone that visited kind of remarked on how miserable he looked, when he came home first.
But he pulled through, and that was the main thing. Bye. Bye-bye.
Oh, he's been unbelievable. It's been amazing. The last couple of weeks, back to his old self. In fact, I'd say probably maybe lost about 5 years at age. I suppose I could say every morning when we wake up, the one thing that we now look forward to is Frankie at the gate, Frankie waiting for us. He really has become an integral part of our life, and we love him. We really love him, truly. Here we go.
The weight is just a big concern for me, especially when she appears fine and appears to be eating fine.
Kind of had in the back of my head that there was something significant wrong anyway, but hopefully, as I say, it's not too bad.
Oh, the poor dog. This is certainly not good. Okay, so we can see the large swelling that's there.
Hopefully, this time tomorrow we'll be getting him back, please God.
We've given her some fluids and photo, we've taken bloods as a precaution, and we've given her some pain relief and antibiotics before we arrived. Poor Lucy is right.
Well, the main evening news is next here on 1, while the major issues of the day are analysed in primetime at 9:35. Before we go behind the scenes ahead of one of the biggest days of the year, the documentary All Ireland Day is at 10:15.